Hello everybody and welcome to this week's presentation. Today we're going to take a little turn from things, and instead of talking about illicit drugs, we're going to talk about some complications of very common over-the-counter drugs you can buy in any pharmacy without a prescription. And there seems to be this perception that over-the-counter drugs are completely safe because they're readily available, and for the most part that's true. Why are over-the-counter drugs so popular? Well, it's this culture's interest in providing a quick fix for things. When it's too lengthy in time to go visit a doctor's office, we want something fast, we want something available, we want something cheap. And there's a big perception that many over-the-counter drugs, as I said, are harmless. And we find that not necessarily to be true. Um, More your common cough and cold preparations, such as cough medicines with dextromethorphan and allergy medications containing stimulants, are on the rise as far as abuse goes in teenagers. Common non-steroidal anti-inflammatories like Advil and Naproxen can lead to devastating effects in the elderly population. Your simple Tylenol, which is found in so many different types of products in just very small doses, can cause overt liver failure. And these are just some of the things that are problematic in the over-the-counter drug market. Statistically, about 1 out of 12 Americans admit to not even following the directions on the package of over-the-counter drugs. On top of that, you think about 70% of Americans supplement their intake of over-the-counter drugs with herbal and dietary supplements, which are not even regulated by the FDA, and there's really no consistency in the ingredients that goes into these products. So in the early part of the 21st century, the FDA proposed a new category of drugs called behind-the-counter drugs. And this was a result of the booming methamphetamine rise in Midwestern US and rural areas. And this was imposed to regulate drugs, legal drugs such as pseudoephedrine, ephedrine, phenylpropylalamine. These are all very common and legal ingredients in your common over-the-counter decongestants such as Sudafed, NyQuil, and other products. These drugs are not banned, they are not illegal, they're not even listed on your FDA schedule of 1 to 5 categories. But what was happening is pseudoephedrine in particular was a very common active ingredient in crystal meth, and it was not uncommon for crystal meth cooks to use this ingredient and to go from pharmacy to pharmacy to gather up as many packages as they could to make as much batches of product as they could. These new laws now limit the amount of drugs that an individual can purchase. In addition to that, individuals must present a photo ID in order to get the drug. These drugs, again, do not have to be sold by prescription, but your retailers, such as your pharmacies, have to keep a logbook. Most of the times it's done electronically these days, of who's purchasing these drugs and in what quantities. And if law enforcement seems to find a pattern of excessive drug purchasing, they'll single this person out and probably apprehend them. Also, something to consider when making a decision to buy something over the counter, whether it's a pain reliever such as Advil, allergy medications such as Benadryl, is that all drugs that are listed for use in the USA are listed under a source called the U.S. Pharmacopoeia. U.S. Pharmacopoeia lists drugs according to 3 different names: their brand name, their trade name, their generic name, and then their chemical name. I won't even get into the chemical name, but the generic name is most common name for the drug itself, whereas the same generic drug can go under a whole host of different brand names. If you take diphenhydramine hydrochloride, for example, I won't test you on that generic name, but diphenhydramine is the generic ingredient in your over-the-counter Benadryl. It's also a generic ingredient in motion sickness pills, in Dramamine, sleep aiding pills, Tylenol PM. All drugs, as we mentioned earlier in the semester, have different side effects, and some drug manufacturers actually market the same drug as a different drug according to its side effect. Generic drugs tend to have the same dosage, same safety profile, same strength, and same quality as the brand name drugs. They're just cheaper in cost, and that's regulated by the FDA. Some drug manufacturers tend to get shady and skirt around that. For example, there's a product out there called Excedrin for headaches. It's a combination of aspirin, caffeine, and Tylenol, or acetaminophen, I should say. And this is a pretty effective drug for headaches. It works pretty well in most people. So a typical brand of Excedrin for about 50 pills might cost about $8. But now the drug companies get a little smart and they relabel the same drug Excedrin Migraine, which gives you the impression that it's an added benefit specifically for migraines. But if you look at all the active ingredients, they're actually the same three drugs, the same amount of aspirin, same amount of caffeine, same amount of acetaminophen. Yet the price can be marked up an extra $2 just for that word migraine at the end. You need to definitely be a smart consumer when you're purchasing any over-the-counter type medications. Your over-the-counter drugs are indeed categorized according to safety. Your Category 1 drugs are generally recognized as safe, effective, and honestly labeled. And, even the Excedrin example that I spoke about, it's not dishonest because it is effective in treating migraines. It's just a little bit misleading in their labeling. Category 2 is not recognized as the above and are supposed to be removed from shelves within 6 months. These are drugs that have passed their phase 4 clinical trials, have been put out into the market, and then post-marketing analysis has demonstrated that there has been some adverse effects to these medications, too adverse for them to be continued on the market. Category 3 drugs are not legal to be sold in the United States. Now, many polls and surveys will demonstrate that in the United States there is a clear dissatisfaction with the state of how Western medicine is practiced and regulated, which has called for an increased demand and an increased market for herbal drugs and agents. Herbal drugs being marketed as natural products coming from all sorts of plant and herb sources. The FDA mandates that the manufacturers of these products determine that they are safe to use, but there is no mandate in demonstrating efficacy. And if you remember back from the Pure Food and Drug Act that we talked about from 1906, we talked about before the turn of the 20th century, anybody could put any product on the market and label it as being good for anything, those patent medicines. These herbal products kind of fall in between that area. It's unclear whether they should be classified as food, drugs, or herbs. But statistically, it's been found that about 1 in 3 Americans use herbal drugs to treat all sorts of ailments such as insomnia, depression, GI discomfort, just inflammation, chronic pain, just to name a few. There was a law enacted called the Dietary Supplemental Health and Education Act of 1994, which defines and regulates vitamins, minerals, herbs, and other botanicals, and it holds marketers responsible for branding the products and labeling them with the ingredients, both active and inactive. Inactive ingredients being the ingredients that are made to keep it in a pill form or whatever form it's being delivered into. But again, does not really regulate how much of an active ingredient is actually in that product. If you take something like St. John's wort, for example, you may be getting 15 milligrams of product, and you may be getting 30 milligrams of product. There's no real way of determining quality control. Also, something to understand about herbal drugs is this perception of if it's natural, it's got to be safe, and that is not necessarily true. There are certain, quote, natural drugs, natural herbal products that can interact with traditional medications and cause adverse effects. Take St. John's wort, for example, which a lot of people take for depression, and your traditional agents of antidepressants, selective serotonin reuptake inhibitors like Zoloft and Prozac. You mix the two of them together and you can get an extremely high level of serotonin levels in the blood, which can result in something called a serotonin syndrome, which can result in fever, high blood pressure, nausea, vomiting, loss of control with reality, and heart arrhythmias, and even death. So these are things that have to be looked out for and watched when you take herbal supplements. Now, one of the oldest, most common, and still used today over-the-counter products is old-fashioned aspirin, which is one of the best documented medicines in the world. Aspirin has been around since the mid-1800s, give or take. Its common ingredient is acetylsalicylic acid, which is found in willow bark, and people prior to this time used to chew on willow bark for the longest time, for years and centuries, as an effective fever reducer, mild pain reliever. The problem is that the raw willow bark is very, very rough on the stomach and cause severe abdominal pain, nausea, which made it somewhat intolerable to most people. However, back as we spoke about in the 1860s, 1870s, the Bayer Pharmaceutical Company came up with two wonder drugs. One was aspirin, and the other one is what we talked about, was heroin, which is now illegal in the United States. So aspirin has still maintained a very good outlook. It's an effective pain reliever, fever reducer, and it has properties to reduce inflammation, which makes it more effective in treating some types of pain than even opioids. It's non-addicting, and it works on inhibiting hormones that are called prostaglandins, which are released in the human body when cells are injured. High levels of prostaglandins can cause headaches, inflammation, fever, and aspirin inhibits the synthesis or release of these prostaglandins. It's also these hormones, prostaglandins, which enable platelets to aggregate together and form blood clots. So that's another very, very therapeutic potential for aspirin, is by inhibiting the release of prostaglandins, it helps inhibit or slow down or break down the formation of blood clots, which can be responsible for things like heart attacks and strokes. So it's a very, very important and still well-known drug today. However, some of the issues with even plain aspirin is, even in moderate doses, it can be rough on the stomach. By inhibiting the mediators of inflammation, it also inhibits mediators that are protective in the stomach lining, which help secrete a mucus surface to help prevent the stomach acids from digesting itself. So it's contraindicated in people who have histories of ulcer disease, peptic ulcer disease, bleeding ulcers. People commonly take aspirin a day to help prevent things like heart attacks and stroke, but as such, it can cause them to bleed internally a lot more easily. So people who are on chronic aspirin therapy who fall and hit their head could be more prone to intracerebral or intracranial bleeding from a head injury. So these are things that have to be looked out for as well. There is also a situation called Reye syndrome, which is a syndrome that's exacerbated when young children have certain viral illnesses and are given aspirin, resulting in extremely high delirium, altered mental status, bizarre behavior, and sometimes death. It's very infrequent, it's very uncommon, but it is documented in the medical literature. So children under 18 with viral type illnesses should really never be given aspirin when there's other choices available. You're probably very familiar with the pain reliever and fever reducer called Tylenol, and in proper doses, it has a much better safety profile than aspirin. It's very common, used to relieve pain and fevers. It's not a great pain reducer for inflammatory mediated pain. However, there is a very, very low threshold for overdose. When we talk about a therapeutic index, the difference between the effective dose and the lethal dose, it only takes about 8 extra strength Tylenols or acetaminophen at 500 milligrams to suffer an overdose. And overdose on acetaminophen is lethal. It can be responsible for acute liver failure and shutdown, especially when it's combined with alcohol, which can lead to long-term permanent liver failure. And I think in one of our previous lectures, we talked about some of the sequelae of liver failure, inability to detoxify the blood, inability to produce certain proteins that distribute fluid throughout the body. It is the only pain reliever recommended for pregnant women, but even then, there is some research that may be contraindicating that outlook. The jury is still not out yet. It's still recognized as category B in pregnancy, but that still remains to be seen. And another thing about acetaminophen is that it is the active ingredient in so many different types of over-the-counter cough and cold and pain relievers. It's the active ingredient in Tylenol. It's the active ingredient in NyQuil. It's the active ingredient in various cold and sinus preparations and cough medicines. If you're not really looking at the labels and reading the active ingredients and seeing how much acetaminophen is in each product, it could be very easy to overdose on medications. People who are prescribed opioid products such as Vicodin and Percocet, those products have narcotic pain relievers mixed in with acetaminophen as well. So another common mistake is people will take for acute or chronic pain a combination of Tylenol and Advil, and then they'll take a Percocet or a Vicodin for breakthrough pain, not really appreciating that it's not so much the oxycodone or the hydrocodone that's the danger, it's the acetaminophen that really is the toxic component. Another common category of pain relievers and fever reducers are what's called your non-steroidal anti-inflammatories. The most common of which are ibuprofen and naproxen. Ibuprofen, commonly known as Advil or Motrin, or naproxen, usually known as Aleve in its trade name. These medications, again, work on those prostaglandins and cyclooxygenase, and they're very effective in reducing inflammatory mediated pain. More potent than aspirin and acetaminophen, less risk of bleeding than aspirin, although they do prolong bleeding time. They can be somewhat irritating to the stomach. As a matter of fact, one of the #1 causes of peptic ulcer disease are non-steroidal anti-inflammatory use. Taking these medications with food or milk in the stomach may help reduce some of that increase. A lot of these medications taken for long periods of time, though, have issues with causing stroke and heart attacks. And one of the reasons this happens is they raise blood pressure by reabsorbing sodium into the bloodstream. Also, long-term use of these medications has also been linked to kidney disease and renal insufficiency. So in the short term, they're pretty effective, but long-term use brings about some risks as well. And again, sometimes people who are on long-term nonsteroidal anti-inflammatory therapy don't understand that what they're taking may be mixed with other prescription nonsteroidal anti-inflammatory. So a person may be seen in an urgent care for low back pain. The urgent care practitioner may prescribe a prescription non-steroidal anti-inflammatory such as Mobic or Celebrex. And then on top of that, not really educating that individual that they should be avoiding over-the-counter NSAIDs like Advil and naproxen as well, because if they take those for breakthrough pain, they're double dosing on the non-steroidal anti-inflammatories in their bloodstream, leading to what could be a potential overdose. And some of your most common over-the-counter products are your cough and cold and allergy products. These agents only reduce symptoms, though. They don't get to the cause of the problem. Many people suffer from seasonal allergies at all different times of the year, whether it be pollen, ragweed, mold. Probably the gold standard for treating allergies or any allergic reactions is your good old-fashioned Benadryl, which has been around for years. Its generic name is, as we said before, diphenhydramine hydrochloride. And again, this active ingredient is also found in other cough and cold products as well, such as NyQuil and other sleep aids. And it works by inhibiting a chemical called histamine. Histamine is a chemical released in the blood when foreign objects called allergens, which the body doesn't want, are present. Histamine is what's responsible when you get the runny nose, the swollen eyes, the sneezing, the congestion, the itching, the rash. And so what does an antihistamine do? It blocks those effects and it reverses those effects. The overdose effects can cause just the opposite. Can cause flushing of the face, drying of all the secretions, mental status changes, even psychosis. It can cause the pupils to dilate. This is another drug that there is questions whether it really should even still be on the market. This urinary retention and falls in your elderly population are very common with the use of this drug. So this was considered a first generation antihistamine, and one of the major side effects of Benadryl is sedation, which gets you very sleepy. Now, if you're using it as a sleep aid, then that's something that's therapeutic for you. But most people want to treat their allergies without the sedation involved, because this also has a very short time span. One tablet usually lasts for about 5 or 6 hours, so you have to keep taking it for the work. Newer generations of anti-allergen medicines like Zyrtec and Allegra and Claritin are classified as non-sedating antihistamines. Most of these stay in the system for 24 hours and produce a lot less of these side effects than traditional Benadryl. Although something like Zyrtec still, from what I've read about, can cause sedation and drowsiness in about 20% of people that take it. There are also other approaches to seasonal allergies as well. You can inhibit the histamines and you can reduce the inflammation in the sinuses. Some things that are very popular now that used to only be available by prescription are your nasal steroids. These nasal inhalers that introduce corticosteroids into the nasal passages and reduce swelling of the nasal mucosa. The only problem with something like this is that it takes several days for it to work. For it to really get the best effect out of something like Flonase or Nasacort or even any of the prescription nasal steroids, you need about a week to 2 of steady use for it to really appreciate the effects. They do not work on demand. So you may wind up getting something else over the counter like Afrin. Um, and Afrin is a nasal decongestant that shrinks blood vessels. In the short term, it's very effective. The only issue is that after about 3 or 4 days of continuous Afrin use, you get what's called a rebound effect, and you can actually get even worse congestion than you started out with. Um, One of the things I do like Afrin for is if you tend to have issues with allergies and sinuses and you're going up on an airplane, you know how the cabin pressure changes can cause havoc on your ears and your nasal passages. A couple of squirts of Afrin before taking off on an airplane can help reduce that barotrauma, which affects the ears. And speaking of your cough and cold products, there's hundreds of different cough and cold products on the market. Now, here's the thing about the common cold. There is no cure. Antibiotics do not cure the common cold. All they do is probably give you diarrhea and yeast infections for no good reason. Some people come to the office saying, I have a sinus infection, I need antibiotics. Very rarely are sinus infections truly bacterial. Sometimes they are, but most of the times people that come into the office for a sniffle, a cough, a low-grade fever, obviously discounting what's going on these days with COVID, want a quick fix. They want to something that's going to get rid of their cold quickly because they quote, I can't afford to be sick. Well, unfortunately, sometimes that's just the hand you're dealt when you have a common cold. You do have many products out there that can help ameliorate the symptoms of the common cold, but that's all they do. They reduce symptoms. Common cold has to run its course. You have cough medicines that are in pretty much two categories. You have antitussives. They suppress or prevent the coughing reflex. And the most common on the market is a product called dextromethorphan. And something that's not as common but much more effective is codeine. Codeine itself is a narcotic. It's opiate. You need a prescription to get it filled. And it is a very good cough suppressant. It's not always the best idea to suppress a cough, though. Sometimes you need to get that fluid, that mucus, that phlegm up out of your respiratory passages. It's a double-edged sword. If a cough is so severe and so intense that it keeps you awake at night, that it's hurting your chest, then a mild cough suppressant's not the worst thing in the world. Dextromethorphan, as I said, is your more common over-the-counter product, but it's chemically very, very related to codeine, and that seems to be a trend in drug abuse these days, is teenagers going out and getting bottles of Robitussin DM, the DM standing for dextromethorphan, and drinking mass quantities to try to get high. Something to look out for. And then you have expectorants, cough syrups that increase mucus secretions, making them more productive, thinning them out supposedly so you can get that mucus out of your chest a lot easier. Things like Mucinex and plain Robitussin. The bottom line is, though, none of these products have really been demonstrated to be all that efficacious. Most of the medical literature will tell you that your best cough expectorant is good hydration, drinking a lot of water, a lot of warm liquids to open up those respiratory passages, and that does just as good a job as any over-the-counter product. And then you have your decongestants. I mentioned the Afrin before. These constrict blood vessels of the nasal passages, improving airflow. And how do they do that? They do that by mimicking the sympathetic nervous system, by shrinking blood vessels. But what do you have when you mimic the sympathetic nervous system? You have the side effects that go along with that. The rapid heart rate, the jitteriness, the increase in blood pressure, and those are some things that are not the most pleasant effects in the world. There's also been a big market for stomach acid reducers. A lot of people suffer from GERD, gastroesophageal reflux disease, which is a very common situation. And instead of wanting to change lifestyle habits like not eating before bed, reducing intake of caffeine, chocolate, fatty foods, maybe elevating themselves, their bed up at night, and losing some weight. They'd rather, again, a quick fix. So you have a number of different ways to combat stomach acid production. Some are not the best ideas in the world. The most common of which are either calcium or aluminum-based antacids, chewable antacids like Tums or Rolaids. They work quickly. They're pretty effective in the short term. Long-term effects, however, can cause mucosal irritation to the stomach lining, can predispose to things like kidney stones from too much calcium, and then sometimes a dependency on these when you're overdoing it. So over the years, a different medication, which used to be prescription but now is released on the market over the counter, called Pepcid. Pepcid is a histamine blocker. Histamine 2, for example. Okay, so we talked about histamines when we talked about Benadryl. There are different classifications of histamine, so Pepcid blocks a different type of histamine. There are other types of medications like Pepcid, Tagamet, Zantac. These are just a few of the brand names. Pepcid is the one that's traditionally sold over the counter. And the problem is this is not something that works on demand. It takes about an hour for it to kick in, and it usually works best when it's taken on a regular basis. These medications were originally only prescribed for diagnosed peptic ulcer disease, but I guess the demand for it and the cash cow involved with it allowed it to be marketed over the counter. Then you have a entirely different classification of stomach acid reducer called proton pump inhibitors, and these actually work on reducing the mechanism in the stomach lining, which actually produces and releases hydrogen ions, which are responsible for producing hydrochloric acid in the stomach as well. Prilosec or omeprazole is your prototype example of this. Other examples would be Nexium, Protonix, things of that sort you've probably heard of. And they're definitely effective when appropriately prescribed to treat peptic ulcer disease. Problem is that, like I said before, people generally don't read the labeling. They do not work on demand. They do not work like a Tums. You can't just eat a spicy pizza and then down a Prilosec and think that's going to actually prohibit any reflux symptoms. There's also some issues with taking these drugs over the long term. Remember, there's a reason your body reproduces hydrochloric acid to begin with, to break down foods in your digestive system to allow for proper absorption of nutrients into the enteric system. Inhibiting that inhibits proper nutrient absorption. Inhibiting hydrochloric acid also tends to reduce the effectiveness of combating foreign pathogens and foodborne illnesses, leading more to likelihood of food poisoning. There's also been a big correlation between proton pump inhibitor use and a colon infection called Clostridium difficile, or C. diff, causing a condition called pseudomembranous colitis, which can be just a rotten state of affairs. You're talking about profuse diarrhea and inflammation of the colon that can sometimes lead people to be hospitalized, and sometimes even lead people to have parts of their colon removed because the damage and the inflammation is so severe. So these are things that are very well marketed, but probably are not necessary if people would just adhere to better lifestyle choices. And then what's something out there as well are your weight loss aids, which are very common. The societal pressure on the notion of thinness instead of health. There's a big difference between health and fitness. Orlistat, otherwise known as Ali, blocks absorption of fat in foods, leading less fat to be absorbed into the intestine. Some of the effects of that include pancreatic and liver damage, kidney damage, not to mention some really nasty flatulence and farting involved with incomplete absorption. Amphetamine-like drugs have been on the market for years to stimulate metabolism and boost An attempt to boost weight loss. Never been really proven to work though. People tend to curtail and increase their eating habits as well. The body has a way of adjusting to what's called a set point theory. Weight loss is a very complex, or I should say, obesity management is a very complex science which goes way beyond just calorie in versus calorie out. But more information for that, though, you may want to consult a certified nutritionist for a better idea. And Queensboro does have very good nutrition classes, by the way. Okay, so just to recap what we were talking about, just remember to go over and discuss the impact of the Food, Drug, and Cosmetic Act of 1938 that we discussed early in the semester. Prescription drugs. Create an argument for and against changing prescription drugs to over-the-counter drugs. I've had a big argument for the proton pump inhibitors. What do you think? Explain how antitussive cough suppressants and expectorates differ. List the major ingredients in over-the-counter sleep aids. Discuss their effectiveness and their drawbacks. And evaluate the effectiveness of weight-reducing medication and their drawbacks and side effects. And with that, have a great week, and we're almost wrapping up this course, so stay well and study hard.